box number 424 is now arriving.
Hi, this is Yoonji Jung and I'm living in Seoul. People around the world have faced threats from COVID-19, but thanks to Korea's response to COVID-19 called as K-quarantine, I can start ordinary days from the early morning without any change. I experienced how K-quarantine and Korean medical system based on ICT are well organized while I was fighting against COVID-19. Now, I would like to share how I overcame COVID-19. One day, I started the day off by stopping at a cafe on the way to work. COVID-19 epidemiological investigation support system can identify and analyze transmission routes based on the confirmed cases data such as location and credit card transaction history. Oh my, this is my company! There has been a confirmed case in a company cafeteria. You might contact him or her when you visit the cafeteria, so please take the self-quarantine measure and get tested if you have any symptoms. Oh, I got to know that I had contacted the confirmed case thanks to the COVID-19 epidemiological investigation support system. In Korea, a person who contacted with infected patients should be under self-quarantine for 2 weeks. The self-quarantined person should install self-quarantine safety protection app in a mobile phone and be managed by a public officer in charge. In Korea, artificial intelligence helps to reduce much workload in the public health center. It is AI COVID-19 care call.
I'm calling to check if you have any symptoms related to COVID-19. Do you have a fever now?
No.
Okay, I see. So, do you have symptoms of coughing or shortness of breath?
No. AI COVID-19 care call made automatic calls twice a day to check my health condition, and it was convenient for my health condition report to be automatically submitted to the public health center. Suddenly, I have a fever and cough.
Okay, I see. Please visit your nearest screening clinic for a diagnostic test.
Drive-through screening stations in Korea have gained much attention around the world as an innovative way for COVID-19 test. I used the drive-through screening station and found that it was really convenient and safe for everyone. With AI-based diagnostic reagent developed by a Korean pharmaceutical company, I was informed whether to be infected in 6 hours. Unfortunately, I tested positive for COVID-19. After being confirmed, I was admitted to a residential treatment center for intensive care. The medical staff played vital roles to relieve suffering and save lives against COVID-19. Fortunately, AI could really help preventing misdiagnosis in reading X-ray. I received the result of COVID-19 test through telemedicine from the doctor, and thanks to the ITS, medical institutions could check my overseas travel history right away and identify the exact route of infection. Suddenly, I became worse since I already had an underlying disease. I was classified as a severe patient, and also I was in an emergency situation where I should be urgently transferred to hospital. Fortunately, for severe cases who need intensive care like me, the operational status data of negative pressure rooms at each medical institution was systematically managed in real time through the negative pressure isolation room information system. Thanks to the system, I was transferred to the designated hospital equipped with the negative pressure isolation room within the golden hour. Amid the crisis, the new doctor checked my underlying health issues and immediately connected to the DUR system to avoid adverse drug reaction. Drug Utilization Review Service, called as DUR, is designed to prevent inappropriate use of drug by providing necessary information on drug safety in advance to doctors or pharmacists when prescribing or preparing medicine. And with the help of fully equipped medical system, I could be out of the crisis. I could overcome COVID-19 thanks to K-quarantine using ICT. COVID-19 pandemic is still ongoing, and we have faced a much bigger crisis. However, as the darkness of COVID-19 deepens, Korea's ICT will shine even brighter. ICT Korea beyond COVID-19. K-quarantine is creating a new ICT road.